patient under investigation, PUE, were quickly trained just in time on donning and doffing. Now imagine if you were that nurse, putting on PPE that you were told was sufficient for this virus, working in a negative pressure room, maybe, if you had, for something that you hadn't been trained for, and then trying to perform tasks such as insertion of an IV or even sterile procedures. Now imagine staying in that room for 8 hours, wondering if someone, anyone, will be able to get the supplies that you need to care for your patient, provide the break relief that you're entitled to, or just be a resource for you when you care for this patient. This is the reality of the nurses that they are facing in our hospital. The lines of communication between the employee and the frontline staff on protocols for suspected coronavirus patients continues to not reach all shifts, all units in a timely manner. What happens when there's a lack of clear communication both ways between staff and management? Rumor, falsehoods fill the void, stoking unnecessary fear and anxiety. And then the information that the nurses get is very contradictory. In early February, we were told that when dealing with suspected COVID-19 patients, that they would be placed in the negative pressure rooms, isolation rooms for airborne. As far as PPE, we were told level 2 gowns, which are a thicker, heavier gown, N95 or PAPR, and PAPR is the Power Air Purifying Respirator, goggles and or face shields and gloves. Every healthcare is supposed to be fit tested on an N95. That has yet to be done. And if they fail the N95 fit test, then they have to use the PAPR when assigned to a patient in airborne isolation. 2 weeks later, we were told, you can wear thinner gowns, N95 masks, you can wear the goggles and the face shield and the gloves. Now they can be placed on droplet isolation, and if there's a need for additional respiratory support or they're getting worse, then we will move them into the airborne isolation. I can tell you this downgrading of equipment and isolation rooms, there's so many unknowns about this virus that it's of great concern, and this is just one example. Let me make it clear. As registered nurses, we are committed to caring for our patients. That is why we became a nurse, why I became a nurse. But all nurses must be protected on every shift throughout our hospital and every hospital across this country. Because when nurses are not protected, the community is not protected. Now I'd like to introduce one of our presidents, Deborah Berger, who would like to share one of our nurses' stories.
Good morning. My name is Deborah Berger, DeborahBurger. I've been a registered nurse for 46 years in Sonoma County, and I'm president of National Nurses United and also president of the California Nurses Association. I'm going to read a statement from one of our quarantine nurses who works at a Northern California Kaiser facility. She chose to share her experience anonymously, but she is hoping that her story can be elevated to raise public awareness about concerns for the coronavirus response. She said, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick in quarantine after caring for a patient who tested positive. I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. I volunteered to be on the care team for this patient who we knew was positive. I did this because of all the recommended protective gear and training from the employer I thought was being provided. I did this assuming that if something happened to me, of course I would be cared for. Then, what was a small concern after a few days for caring for this patient became my reality. I started getting sick. When Employee Health told me that my fever and other symptoms fit the criteria for the potential coronavirus, I was put on a 14-day self-quarantine. Since the criteria was met, the testing would be done, and my doctor ordered the test through the county. The county officer called me, verified my symptoms, and agreed with testing. But the national CDC would not initiate the test. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of the health of this country. Later, they called back, and now it's an issue with something called the identifier number. They claim they prioritize running samples by illness severity and that there are only so many to give out each day, so I have to wait in line for the results. This is not a ticket dispenser at the deli counter. It's a public health emergency. I'm a registered nurse, and I need to know if I'm positive before going back to care for patients. I'm appalled at the level of bureaucracy that's preventing nurses from getting tested. This is a healthcare decision my doctor and my county health department agree with. Delaying this test puts the whole community at risk. I have the backing of my union. Nurses aren't going to stand by and let this testing delay continue. We are going to stand together, so we can make sure that we protect our patients by being protected ourselves. This concludes this powerful statement by our quarantined nurse, and now I would like to introduce our union's industrial hygienist, Jane Thomason. Thank you.